And let's move to our third bridge of today, who is a powerful advocate for access to life-saving treatments, policy reform, and greater awareness of the challenges faced by people living with sickle cell disease in Canada and worldwide. Je voudrais quand même indiquer que j'ai été très ému quand je l'ai rencontré, quand je l'ai revu aujourd'hui, parce que j'ai rencontré cette dame par hasard dans ma petite carrière de journaliste. Je suis au Manitoba actuellement et une jeune étudiante âgée de 24 ans est décédée et elle souffrait de drépanocytose. Mais il s'est avéré plusieurs semaines plus tard qu'en réalité, le traitement n'était pas approprié. Je ne pourrais pas vous parler comme un médecin, mais c'était une jeune étudiante pétrie de talent qui avait toute sa carrière devant elle. À 24 ans, dites-vous bien qu'elle dirigeait la Fédération estudiantine canadienne au Manitoba et avait beaucoup d'ambition au niveau national. Je ne pourrais pas vous prendre plus de temps pour vous expliquer, mais simplement vous dire que c'est dans cette occasion que j'ai rencontré cette dame qui siège au comité mondial de l'Alliance mondiale des organisations de la drépanocytose et qui, au Canada, est présidente et directrice générale de l'Association canadienne de l'anémie falciforme. Je vous prie d'accueillir Biba TINGA.
Thank you for this great introduction. Good afternoon, everyone. Bon après-midi, tout le monde. Thank you for being here today. I'm going to share some stories with you today, stories that are difficult to hear but essential to understand. These are just not case studies. They are our warriors, our children, our community, and they deserve better than is being currently offered to them. So I want you to hold on to these stories and hold on with me today, because at the end of our time here today, I'm going to ask something to each of you, okay? December 22nd, 2021, Jason Ikete Bukana was 28 years old. That morning, he went to the hospital in Quebec for his red blood cell exchange treatment, a routine he knew very well. He rushed back home to work for the rest of the day, and he was alone in his apartment. At some point, he went to lay down, but he never woke up. His younger sister, Megan, found him when she got home from work. The coroner concluded it was pulmonary embolism. We know it was a delayed hemolytic reaction from the blood transfusion he received that very day. A family is left mourning their firstborn, and Megan was left with a trauma that our limited resources cannot handle. The Quebec Association for Sickle Cell was able to provide her with 5 sessions of mental health support. 5. But she needed more. All we could do was direct her to the CLSC in Quebec and hope they will help her quickly. She was 24 years old. September 2020, 3 a.m. Eastern Time, my phone rings. The young woman online introduces herself as Velissa Providence from Alberta. She tells me she's been in crisis for over 24 hours and has been sitting in the ER waiting room for over 6 hours. No care, no relief, just pain. We are used to hearing these complaints, so we know what to do. I asked her to hand the phone to the head nurse, of course, after telling him that she allows me to advocate for her. I asked him, did she disclose her sickle cell upon arrival? Yes, he confirmed. Is there a protocol for sickle cell patients in this hospital? Yes, he confirmed. Then I asked, did you follow it? He tried to belittle me. He said that in all his years of practice, he had never experienced such a call. I stood my ground. I asked him to please follow the recommended protocol and advise him that we will file a complaint. A sickle cell patient should receive care within 30 minutes of arrival. That night, after suffering for long hours, the necessary, Velisa finally got the care she needed. Dr. Jill Walrond, then president of the Sickle Cell Foundation of Alberta and a caregiver herself, met with the hospital to understand what went wrong. They kept saying that she was just addicted to pain medication. They were simply cutting off her prescription because she needed too much painkillers. We advocated as much as we could, but we were met with an incooperative system. We took it to the press. We asked Velisa to share her story. If you search for it, her TV interview is still online. Thursday, November 16, 2023, Velisa passed away. Her fragile body could not take the pain, the stress, and the lack of proper treatment. Her mother, who was at retirement age, is left to raise a 4-year-old. This is the reality of dealing with sickle cell disease in our country. We stand and fight sickle cell daily with minimum resources, only 2 treatment options, hydroxyurea, a cancer drug, and blood. No proper guideline across care centers, no research, no data in Canada. Now, let me tell you about Alvin Merchant, 50 years old, from Ontario. Alvin has not left his house in 3 years, since September 2023. He has been experiencing extremely painful leg ulcers that prevent him from walking, sleeping, having a clear thought due to chronic nerve pain. He can't even wear shoes. They told him it was the effect of being on hydroxyurea for 35 years. He was one of the first people to start using this drug in Canada. But there was no research being done to predict what could happen with such prolonged use of the drug. But what else can he do? There is no other option. Now he has to take the risk of stopping the medication so his legs can heal. Mama Murch, his mom, and I are scared to death. But imagine what he feels as the warrior who is living this uncertainty. Now, I'm a mom myself. My son Ismael is 36 years old. He's been receiving blood transfusion every 6 weeks for the past 12 years. Every treatment now comes with a delayed reaction. He's tired for days. He can't even get out of bed. He can't walk. He can't do nothing. And when he has energy after the treatment, it's not for more than 2 weeks. We as a family are all affected. We drive him to and from work. His boss, Nadim Abadir, not the name, Nadim Abadir, his boss, is now part of his care team, providing him with accommodation so that he can keep his job. You know that our system has failed when a caregiver and an employer have to figure things out together. That is wrong. As a treatment option, he was offered to combine hydroxyurea and red blood cell exchange. No. As scared as I am for him, he cannot stop his current treatment. His body can't take it. So what's the solution for Ismael? I want him to get maybe gene therapy. But he needs to stop this treatment maybe and be on hydroxyurea so that he can be considered. He is not eligible for any clinical trials that comes to Canada because they tell him that he's been on red blood cell exchange for such a long time. He's not a good candidate. So some days, he gives up. He stays in bed, emotionally drained from the daily fight to live like any of us. He's just too tired to live. When your child tells you, Mom, I'm tired. I can't do this anymore. And we have to rely on faith. And I tell him, healthy people died before you just by crossing the street. If you are here, there must be a reason. So keep fighting, and I will stand for you. What quality of life do you have when you have to stay in bed from Friday to Monday so you can show up to work for the week? There are no accommodation for our warriors. Getting disability with sickle cell is a heartbreaking battle against an incompassionate system. It took 19-year-old Odobi McAllister 2 years and 3 attempts to get it in British Columbia. How do you survive in the meantime when you don't have a job? You can't go to school. So when they say people are living longer with sickle cell disease, ask about the condition they live in. Ask about the quality of life. Ask about the life expectancy, because 50 years old is too young to die in Canada. It's just too young to die. There are statistics to predict how many babies will be born with sickle cell disease, but nobody talks about the death toll in our community. It's 1,024 daily globally. Let that sink in. 1,024 people die every day in the world from sickle cell disease. Let that sink in. So, as a Black researcher, healthcare provider, community organizer, if you are in a position where you can contribute to the sickle cell cause and you are here today, we need you to stand with us and for us. Research the heck out of this disease. Master its care. Treat us with dignity and respect when and if you meet us seeking for care. These stories I've shared, as impactful as they are, if we do not turn them in data, we cannot use them effectively. So that's why the Sickle Cell Disease Association of Canada initiated the first national sickle cell disease registry, but we struggled to get it funded. We struggled to get it funded. We get denied funding for a sickle cell registry in Canada. The Honorable Meji introduced the Bill S201, which will be one of the most significant and effective support for our work and our community. You've heard it. On November 18, 2 days ago, it passed at the Senate, and it's now on its way to the House of Commons. But it will only be helpful to us if it becomes a law and if it's implemented in your work every day. So, all around this table today, I've seen the strength of this community, and we have strong allies, people who don't look like us, sitting here working with us, right? So, let's ask ourselves, what can we do as members of this community, and which tangible action you can take, you yourself today, to support this cause? Ask yourself what will be your legacy when it comes to the only disease that disproportionately affects Black people in Canada. What will your legacy be? Because the Dr. Sena and the Dr. Dorduno have done their best. They've working day and night with me, but we need more allies and more soldiers. So I'm going to leave you with this. Yes, I'm going to leave you with this. This is my ask to you. When you get home, call your elected MPs. Before we do that, by the way, my phone number is 514-266-9083. I will tell you why. 514-266-9083. When you call your MP, ask for an appointment, go and meet them and tell them these stories. Tell them that you need them, that the Bill S201 is coming their way and you need them to support it. And you tell them this, that we don't have time for it to go through all the long process because our kids are dying. They need to therefore go off the debate and go straight to the vote because we need a law now. You do that. And if you take a picture with that, please send it to me and I will give you a shout out on social media. Thank you.
Et là, je la reconnais particulièrement, Biba TINGA, pour ses témoignages poignants et surtout le plaidoyer qu'elle porte sur la question de l'anémie falciforme. Je pourrais vous en rajouter en disant que, en tant que journaliste, lorsque on annonce des cas de drépanocytose, même dans notre travail au quotidien, il y a beaucoup de collègues qui me demandent de quoi il s'agit. Et parfois, dans les réunions, je me transforme un peu en petit médecin parce que je viens d'Afrique et que le mot drépanocytose n'est pas étrange pour moi, en fait. Mais malheureusement, ce n'est pas connu ici. Il y a beaucoup de choses à faire. Et peut-être que ce projet de loi peut effectivement inverser la situation.